Hey everybody, just want to say hello and let everybody know how I'm feeling. Last video I put up, I think it was a Hulk Juice video. And the one before that was a Horrible Summer, based on all the blood loss that I've been dealing with. Well, that has happened again to me since January of 2015 of this year up until now. Still getting some blood loss, but we've kind of come to the bottom of the issue, and hopefully we have this resolved now. And I just want to talk about that with you guys. So basically, been dealing with blood loss since January again, feeling tired, fatigued, um, you know, just want to go to bed, no energy to do anything. And with the weather that we've had here in the Northeast and Massachusetts area, a lot of snow, going out there shoveling and snow blowing, it takes a toll on your body as well, even if you're, not a healthy person, or, in low blood as well. So it's kind of put a strain on me and my body quite a bit, and, wiped me out completely until I got blood transfusions. And after the blood transfusions, I feel pretty good for a week or so, and then had to do them again because my numbers were low again, which is hematocrit level. Was down to 20, 23, 24, 25, 26. That's my low numbers where I have to get a transfusion, whether it's 1 unit or 2 units. So basically, about a month ago, I did a bone marrow biopsy to determine what was going on. And basically, um, the bone marrow biopsy is just to figure out if I had any kind of leukemia cancer, because leukemia patients, suffer a lot of blood loss and have to get blood transfusions. So they're trying to find out if that was my issue. So last week I went in for my results, and the results came in from Mayo Clinic, and it was a negative. No cancer, thank God. It was a horrible 2-week waiting period to get those results. I felt like I was on the edge of a cliff waiting to hear these results, but I was happy to hear that I didn't have to, suffer anything from leukemia or have to go through any chemotherapy or radiation for that. So basically, I've been on Prograf and Remicade for quite some time now. Prograf almost 20 years now, which since my transplant of May 95 will be 20 years I've been on Prograf. And Remicade I've been on for a few years off and on. That basically, those drugs, it's an anti-rejection drug, Prograf, and the Remicade is to control my Crohn's flare-ups, and I'm on that every 4 weeks for a infusion injection. I take the Prograf orally every day, 8 milligrams. So basically, these drugs have lowered my kidney functionality, and basically your kidneys tell your bone marrow, hey, this guy's red blood cells are low, please make more red blood cells from the bone marrow. So when my kidneys are not working normally, it's not doing that job. So they come to a resolution that I have to take a hormone drug. I forget the name of it, but it's a pretty long name. That basically, it's going to tell now the kidneys, hey, this guy's blood count is low, please have the bone marrow produce more red blood cells, and that's what's going to happen. And in the meantime, I might have to still get a blood transfusion every now and then. My first injection was last Wednesday of this new drug, hormone drug, and all it is basically, it's like getting a flu shot. You get it in the back of your arm, in the muscle area, I think, or fatty tissue area, wherever they want to do it. Excuse me. So I'll get this every 2 weeks. So I'm going up to Leahy Clinic, which is where I'm getting my treatments done, tomorrow, to have another injection done. So hopefully this will help me get things going again, and I won't have to get any transfusions, because I did have to get one last Thursday after I received my Remicade treatment, that I had to get another blood transfusion. So I'll keep my fingers crossed, and hopefully this will work. And that's about it. And it's just the struggle that I've been going through in my life, and right now with my Crohn's, I think I pretty much have it under control with Remicade and eating specific foods, trying to eat healthier, keep that under control. It seems to be helping me right now. So we'll see what happens with that. In the meantime, I guess I just got to keep fighting. I've been going to the gym when I've been feeling better. I've gone this week. I went a little bit last week. Week prior I didn't go because I was feeling horrible, tired, weak again because blood was low. anyways, I just want to thank you everybody for, you know, their prayers and their thoughts and their kind words that they've sent me via Facebook or emails, calling me, texting me. I appreciate that very much. And if there's anybody out there who has questions on based on what I've been going through, whether it's my liver transplant or Crohn's disease or blood loss, you know, send me an email. I'll be glad to answer any questions if you have any questions or thoughts or whatever. So I appreciate everyone watching this video. Share it if you'd like. You know, the more people know about, you know, these type of drugs and treatments, the better, basically. So that's about it. Finally, the weather is starting to subside here in New England. It's not snowing right now. We've had warm weather in the 40s, so it seems like spring is around the corner. We just had daylight savings time, so days are getting longer. So the longer the sun's out, the more the snow will melt, which I'm happy about. We still have a lot of snow out here in the yard and around the neighborhood that has to be melted. So it's here. It's going to be easier now after this. It's been a long, tough winter, that's for sure. And one of my hardest winters to deal with yet since being home. Anyways, thank you guys. Thanks for watching. Take care. Peace out. Bye-bye.